Fluffy Goldberg.
I'm Michelle Collins.
And I'm Candace Cameron. And today, the topic of this show is general medicine, and more specifically, certain diagnostic tests and imaging that can be done to help reach a diagnosis. As a special co-host today, we have Dr. Jennifer Berman, a radiologist from the show The Doctors, to help us answer some of our questions.
So the four most common diagnostic tests that I do are EMGs, echocardiograms, CT scans, and bone scans.
Miss Paula Ferris, I think that your card over here says bone scans, doesn't it?
That it does. And bone scans, according to my card, are an imaging test that displays areas of increased or decreased bone turnover or bone metabolism. They can be used to diagnose a tumor, bone cancer, a fracture, bone infection, determine the cause of bone pain if no other cause has been discovered yet, and they can help evaluate metabolic disorders such as osteoporosis.
Wow.
Yeah, wow, that's really interesting. How are these tests performed?
Well, first a small amount of radioactive material is injected into the vein. The substance travels through the blood to the bones and organs. As the material wears off, it gives off a little bit of radiation, which is then detected by cameras which scan your body. And the camera takes images of how much radio tracer gathers in the bones.
Wow, how long does this usually take?
The timing's dependent on what the bone is being examined for. If an infection is suspected, the image may be taken shortly after the injection is given, and then again 3 to 4 hours later. If we're looking for metastatic bone disease, images are only taken 3 to 4 hours after. And the camera, the imaging usually takes, the scanning portion generally takes 1 hour.
Now, as an older female, would it be suggested that I would ever have this done?
Well, everyone above the age of 70, it is suggested that they receive a bone scan. But women, it is highly suggested because of menopause. The only people that cannot receive bone scans are women that are pregnant.
Shoot, I wish I was back in those days.
3 kids. I'm all done with that.
And those with bilateral hip replacements or hip screws and pins prevent the hip sites from being scanned, so they generally look at the spine. But if both of those sites are unavailable, they scan the forearm.
Wow.
Sure.
It's pretty interesting.
I didn't know all those details about that. Glad you informed us.
So you said that yours does cancer. That's cool.
That it does.
Well, my card thingy here says that CT scans can check for cancer when they're looking at tumors and other masses, and it also helps to guide surgeons to the right area when they're doing a biopsy, as well as it can be used to diagnose an infection and to study blood vessels. So, cool.
Very cool.
Yeah.
What is your test again?
It's a CT scan or a computed tomography.
I always wondered what that stood for.
Yeah.
So how's it performed?
Well, first they make you take off all your jewelry, which don't want you to laugh, but whatever. And you wear a hospital gown. Again, my booty ain't gonna work out. Then they make you lie on this very narrow table, and it slides into the machine. And then the computer will create separate images of the body, which are called slices. And they usually only last a few minutes, and in fact, a newer machine can do a full body scan in under 30 minutes.
Wow.
Wow, that's so interesting.
Very efficient.
Now, I mean, you all know me and my love for food. Would I be able to eat before I had this test performed?
Well, it depends. Some of them use a certain type of dye that is injected, and if you have that type of dye, you will have to fast for 4 to 6 hours prior.
Come on.
But other ones, they don't use this dye, so you can just go in right after having a big nose burrito.
You know, I'm all about those.
Who doesn't love a good nose
Endless
burrito?
chips.
Chipotle, say.
Unlimited chips.
Chipotle.
Those endless chips, though. And then, speaking of this dye, however, a lot of people will suffer from allergic reactions, so if you've ever had a test that has used dye before, you should talk to your doctor. And they also say that most machines cannot hold over 300 pounds, so I'm very sorry, but some obese people will not be able to have this.
Yeah, some overweight people, since they also have heart issues, they might need an echocardiogram.
My card says echocardiogram, so I'll just
okay.
yes, I will just dive right into that. You know, so an echocardiogram or echocardiography is also called an echo. It tests or an heart ultrasound. It uses sound waves to produce images of your heart. It allows doctors to see how your heart is beating and pumping the blood, and it sometimes identifies various abnormalities.
Wow. So how is this all performed?
All right, so it's done by a trained sonographer. It can be done in a doctor's office, an emergency room, an operating room, a hospital clinic, or a hospital room. And you lie on your left side or your back. Before that, obviously, you undress from the waist up, and you'll be lying on a table or bed, kind of like yours as well. And a technician or a sonographer will attach sticky patches, which is called electrodes, to your body to help detect and conduct the electrical currents of your heart. So there's a few echocardiograms that I have on my card, so I'm just going to talk about them. So a transthoracic echocardiogram is a standard non-invasive echocardiogram that a sonographer does. They put a little gel in your chest after placing those electrodes, and this device or transducer records a sound wave that echoes your heart that produces. A computer converts the echoes into a moving image on a monitor, so if you do this, you can see it. And if your lungs or ribs block the view, a small amount of intravenous dye, kind of like yours, may be used to improve these images. A transesophageal echocardiogram, this occurs if it's difficult to get a clear picture of your heart. During this procedure, a flexible tube containing a transducer is guided down your throat into your esophagus, which that part it connects your throat to your stomach. Your throat, yeah.
Wow. It's a big word.
Esophagus, yes. Your throat will be numbed, so you'll have medications to relax during this procedure. Another kind of echocardiogram is a stress echocardiogram. So some heart problems, like you're saying, some obese people, particularly those involving coronary arteries that supply blood to your heart muscle, occur only during physical activity. So this echocardiogram will be taken before and immediately after walking on a treadmill or riding a stationary bike. If you're unable to perform exercise or things like that, you may get an injection or a medication to make your heart work as if you were exercising.
So, what would I have to do if I needed one?
You may not be asked to eat for a few hours beforehand. In a treadmill or a bike, you need to dress appropriately. During this time, some people may ask, what are my risks or something like that. For a standard transthoracic echocardiogram, you may feel some discomfort with the probe or when you pull off those adhesive bandages. But other than that, there are no real risks associated with. In a transesophageal echocardiogram, your throat may be sore for a few hours afterwards, but that's about it.
I mean, it sounds pretty invasive. What exactly will it show?
So, for a transthoracic echocardiogram, this test will show the shape and size of your heart, how well your heart is working overall, some walls or sections of your heart muscle. If those are not working correctly, you'll see this on the screen. You may have some problems with your heart valves can also be seen, and if you're having a blood clot. This test may be needed if you have a heart murmur, a heart attack, an unexplained chest pains, a fever, or congenital heart defect.
Well, ladies, have you tasted the coffee today?
Delicious. Colombia or something.
Colombia?
Yeah.
Great brew
The
today,
Colombian
great
one.
brew.
Excellent.
Well, these have been some of the most common diagnostic tests that we use, but my personal favorite to perform are EMGs and nerve conduction studies.
Oh.
Wow. What a coincidence.
Michelle!
Please tell us more.
Okay, so an EMG, also known as an electromyogram, measures the electrical activity of muscles at rest and during contraction. A nerve conduction study measures how well and how fast the nerves can actually send these signals, also known as nerve conduction velocity.
So this sounds interesting. Why would somebody need either of these tests?
Or muscle twitching, and problems in the muscle, the nerve supplying a muscle, the spinal cord, or the area of the brain that controls the muscle can cause these symptoms. And basically, it's meant to find damage to muscle tissue, nerves, or junctions between the nerve and the muscle. A nerve conduction study helps find the damage to the peripheral nervous system, and basically, if there's a problem in the muscle, which includes all the nerves that lead away from the brain and the spinal cord, and the smaller nerves that branch out from those muscles, this can be detected, and an example of this is carpal tunnel syndrome.
Ooh, that's
From
cool.
texting, you know?
Yeah,
Or on those laptops all day long.
Mhm.
So how do all of these shenanigans work?
So basically, an EMG, with this, a needle electrode is attached by wires to a recording machine and then inserted into a muscle. Yeah. The electrical activity in that muscle is recorded while the muscle is at rest. But also, the clinician, such as a doctor or the technician, will have the patient contract their muscle, and this will also be recorded.
While the needle is in there?
Yep.
Oh.
I know. It's pretty
That's
amazing.
a lot.
Yep.
Why is this your favorite? Oh my god.
And this takes about 30 to 60 minutes. With a nerve conduction study, several flat metal disc electrodes, just like you have electrodes, are attached to your skin, and a shock-emitting electrode is placed directly over the nerve, and a recording electrode is placed directly over the muscle. Several quick electrical pulses are given to the nerve, and the time it takes for the muscle to contract in response to the electrical pulse is recorded. The speed of the response is called conduction velocity, and this takes anywhere between 15 minutes to 1 hour.
What contraindications would doctors and patients be aware of if they were having this test?
So basically, if a patient is on blood thinners such as Coumadin or an aspirin, the doctor may tell the patient not to take this beforehand. Also, if the patient is experiencing any bleeding, swelling, or has too much fat or adipose tissue over the skin at the site of the nerve or the muscle, it might not accurately be recorded. But other than that, there are no contraindications because both procedures are generally safe. There's no chance of any infections at all with nerve conduction studies because it's just the electrode over the skin, so nothing's going into the patient. And an EMG is generally really safe as well because although the needle is going in, it's really sanitary, and there's been no large amounts of infection seen with this test.
That's good.
Mm-hmm.
The body, what an amazing thing, you know?
Yeah, it's insane. Well, I just want to say thank you to all of our little people who researched all this stuff for us.
And to our special guest.
Yeah, Miss Jennifer Berman, Dr. Jennifer Berman, thank you for coming.
It was my pleasure to be here with you guys.
Thank you. Well,
Take a little time to enjoy the view.